Good afternoon, everybody. Thank you for coming to the Providence Healthcare St. Paul's Hospital Medical Grand Rounds. And it's my pleasure to introduce these Grand Rounds. Dr. Kristine Chapman is going to be presenting, as well as Dr. Andy Ignaszewski, and they'll introduce themselves when they come up. I'd first like to do a land acknowledgement and express my gratitude for being on the traditional, ancestral, and unceded territories of the Squamish peoples, the Tsleil-Waututh, Musqueam, and Squamish. And we're very grateful to be on these lands and for their stewardship of the lands. And we're also committed to the calls to action from the Truth and Reconciliation Commission, as well as our work in the department to respond to the recommendations from the In Plain Sight report. So I would just like to say that the Department of Medicine has developed this innovation platform, and I'd like to acknowledge the origins of this. It came from Dr. Andy Ignaszewski was the interim Department of Medicine head, and he tasked all of the divisions to come up with ideas around what they wish they could change in care, because we had the new St. Paul's coming up, and we didn't want to move into a new shiny building and do the same things as we were doing here. And so we realized in order to transform care, it doesn't come from the top up, it comes from the people who are working frontline with the patients and how they want to improve care. And so all of the divisions came up with many ideas, and we had them refine them and submit them. And then when I became department head, I've worked closely with Andy and the team, and we have worked on this innovation platform to transform these ideas into action. And we're going to hear how we're going to bring these ideas to life in some of the examples that we've had. So we were able to garner some resources and put it towards improving care for the patients, and also to help make the work that we do together more meaningful for ourselves and more particularly for our patients. So I'm going to hand it over to Dr. Kristine Chapman to share more about this.
Great, thanks Anita, and thank you for joining us today to talk about innovation and how the Department of Medicine can support your ideas. So innovation has long been a characteristic of Providence Healthcare, really going back to the founding sisters, who were incredibly resourceful and constantly problem solving. The story of innovation here began really more than a century ago, when the Sisters of Providence arrived in Vancouver, and at that time it was a burgeoning city of about 34,000 people in 1894, and they built this 25-bed cottage. And indeed, within a few years of opening, St. Paul's Hospital was one of the first hospitals to use x-rays and one of the first to use radium to treat cancer. So you can see that innovation is really embedded in our DNA here at Providence. The sisters purchased 7 lots for $9,000, which was really a pretty shrewd decision back then, because as you know, in 2020, we sold that property for about $1 billion to invest in the new St. Paul's. And by that time, well, here we are in 1939. I love this photo. They had 300 fully, decked out nurses and staff lining the street to welcome Queen Elizabeth as she comes in for the opening of the Hotel Vancouver. And by this time, vaccines had been developed. Mellanby had realized that vitamin D deficiency causes rickets, and importantly, we had the Band-Aid. So innovation was well on its way. And I think the point of this history is that we really have an obligation to continue to evolve our care, to innovate, make things better. When I was a resident, we still were providing geriatric care in these multi-bed, single-room wards. We look towards the new St. Paul's. We have 548 single rooms, 100 of which have negative pressure systems that are ideal for managing patients with infections. So it's imperative that we change the way we practice. And at Dom Innovation, we're really committed to the idea that we will be doing care differently in the new St. Paul's, not just have new bricks and mortar. So The Department of Medicine Innovation Platform is really a mechanism to bring you, the Department of Medicine members, to bring your great transformational ideas to life and to support you as we look towards the opportunity of the new St. Paul's. So what are we going to do for the rest of the ground rounds today? First of all, we're going to talk a little bit about the nitty-gritty. What have we developed? What's the system that we've developed to help successfully transform ideas? Secondly, Andy's going to share with us a little more of the history, but really focus on highlighting a few of the successful projects that have come through the pipeline. I'm going to tell you a bit about a new initiative that we've started. We were successful in getting a substantial grant through shared care with our family practice partners, looking at value-based healthcare. We're going to comment on how DOM innovation fits into the larger PHC ecosystem and how we can all work collaboratively to really create synergy within the organization. And then we'll end with a few reflections on a really important topic, burnout, and how perhaps innovation might be an antidote actually to burnout. So we talked about innovation really being imperative. But I think in modern healthcare, we know that we can't take it for granted. Innovation doesn't just happen, but it must be nurtured. And that's why DOM Innovation was created as part of the larger ecosystem to really support the development and implementation of these transformative ideas. This graphic, I think, illustrates really nicely what DOM innovation is all about. It starts, of course, with your ideas. Innovation comes from the bedside, and it's your recognition of gaps in care and opportunities. That's the far left-hand light bulb. Our platform has two parts. First, the Innovation Hub, which is sort of the clearinghouse where we bring in proposals and develop perhaps a business plan that is made into a project charter and then implemented. After we've been in business or been in action for a couple of years, we've been learning and learning. We looked at the literature from the business world and realized that the success of new projects goes way up in some cases when you have an incubation phase. And so we created an incubator for certain projects that needed a period of time to gather data, to show efficacy, to take that to the funding agency for ongoing support. So in some cases, we can provide an incubator phase. And then we have two through lines, value-based healthcare, and of course, the pathway to the new St. Paul's. One of the keys to success is having a defined pathway. You know, we're busy, we're all busy, and we can't do this off the side of our desk on Sunday nights and reinvent the wheel every single time. So we've created a well-defined pathway that starts with engaging stakeholders, engaging your leadership and the operations. And the first step, which you can go to our website and click on, a very low barrier, easy initial template. That will be reviewed by our internal team and look at what are the impacts in space, on programs, et cetera. You can see on the far right, and then it goes to our steering committee, which you'll hear more about. Once the project is greenlit, there's also templates for developing the proposal and then ultimately the project charter. And now it goes through into implementation, and we're just building out our evaluation phase. That's something we're working to add in. But this is a sort of a well-defined pathway to success. Another, I think, really critical component of our success is our working group, and we're really very grateful to the working group. The expertise, they evaluate all the proposals, but also provide really key feedback, not just to the individual proposals and physician leads, but also to us as the DOM innovation sort of team. And they've been really key. And I'd like to also highlight our partnership with the St. Paul's Foundation. That's been really, really terrific to have that that working relationship on dom innovation. Also, you can see Deb Mitchell here highlighting the connection with Ideas Forward organizationally. I think that collaboration, and Mark Greenfield, that's been really key as well. So what can dom innovation provide? How can we help you? We can provide financial support for some of your time, so that you can set aside time to think about innovation and transformation, and then do some of the work that's needed. We can pay for someone who actually has excellent skills at business plan development and some project management. And we've heard from our feedback that actually some of the most important things that we can provide is the mentorship and just opening doors. You know, Anita and Andy can set up a meeting with anybody. You know, they can call in, you know, the phone will get picked up, and you can get in the door for the meeting. So I think those pieces shouldn't be underestimated. In this photo, I just really want to highlight Mehek here, who's here in the room. She won't want to hear it, but she's really the cornerstone, and she does so much behind the scenes support. So really a big shout out to Mehek and all the work she does. She maintains sort of a project flow charts and makes sure that projects are moving forward. So we've seen what the flow is for our process, and I'm really excited to let you know that we've had, I think, 13 projects now at some point in our through the wheel, and now they're coming out the other end, and it's so exciting to see the incredible work that's being done. I'm going to hand it over to Dr. Ignaszewski to highlight some of those amazing projects.
Thank you very much, Kristine, and good afternoon, everybody. I realize I'm old enough, I guess, that I'm always going to be asked about history of something, and there it is. As Anita mentioned, I was given this interim job as the department head, and as I was taking on that job, I decided to learn more about the department. As you know, I'm a cardiologist. I was most of my productive life, professional life, I spent in the heart center. But as I started reading about Department of Medicine, I realized it used to be called Division of Medicine. It was created in 1923, not long before I was born. And it was, in fact, the first division in the hospital. Prior to that, the only physicians working in St. Paul's were surgeons. So we had the first Division of Medicine, which then became a Department of Medicine. And I realized that 1924, there's going to be 100th anniversary of our department in this coming year. And I started thinking of how to celebrate, since our department is composed of 18 divisions and several research centers, has been front and center of tertiary and quaternary programs, but also looks after needs of patients in the West End. I decided to challenge our divisional directors with creating a document outlining their best accomplishments up to date. And that's, you probably don't see much of it, but this is that first document. And I realized that we are the leaders in many aspects, international leaders, national leaders, Western Canadian and provincials, and that sort of sense of accomplishment to date led me to believe that we had more in us. I happen to believe that innovation is not a luxury. This is not something you do because you're at St. Paul's. Innovation is a must, and it is for the patients. Innovation results in better patient care, and since we are patient-centered care, obligation is that we innovate and transform the health system, and that's what we all have to do. I shared the findings with my colleagues in the Department of Medicine, and then I realized that to move it forward, the next stage was challenge divisional heads, and through them, departmental membership, to come with the best 3 proposals going forward. This was a little bit naive on my part because we ended up with 50 different proposals, and this is no way good moving forward. The only money that we had for that is courtesy of Dr. Palepu, who negotiated as a part of a recruitment package $100,000 to be set aside, which she didn't take, to set aside for those activities. We quickly realized that probably the best way moving forward is to come up with one single project per division in round 1. That was we discussed. I think Kristine already mentioned to you the process that we went through. One of the things is when you evaluate projects, you want to be above board, you want to be transparent, and you want to make sure that once that evaluation takes place, that everybody, be exactly happy with the outcome, some of them, but at least they believe it was fair. And for that reasons, we had this working group. We had 6 domains by which we scored the system. I have it written, but somewhere, but innovation and sustainability and costs and adjacencies to existing programs were few. We scored that on the 1 to 10, and this is all in that document. By the way, those documents are available for you to review. They are in Word format. We don't have PDF, I don't believe, but I think lots of thoughts were into it, and I think it's a part of the history prior to moving to St. Paul's. I'd like to show this to you. This is round 1 evaluation. You will see, I believe, 17 projects there. This may not be all that clear, but we decided to move the first 3. You notice the cardiology, unfortunately, didn't make it in the first month. However, the 3 first ones went through, and in fact, we expanded them into 5 of them. And I think I'm going to show with you some of the ones that have been successfully completed. The first one was Medical Dermatology Center. Many of us think of dermatology as a sort of cosmetic specialty. However, the group at St. Paul's, the divisional membership at that time led by Dr. Sheila Au, who has been instrumentally moving this forward, then Marisa Ponzo and now Noel Wong, wanted to create a dermatology center. With that, they were supported by UBC. That's the 5 different medical dermatology clinics, most of them the only ones in the province. We had a separate MedSafe clinic. As you know, 25% of hospital admissions may be created by us, iatrogenic injury, most of it's in the skin. We combined the 2 projects, were able to get funding from it for Shared Services Committee. We've gone through St. Paul's Foundation, one of my donors generously donated to that. We got a space for it, and we established this clinic, paid for through phototherapy booths. So my colleagues, instead of taking the money home, decided to pool that money and hire a secretary, and that has been ongoing for quite a time. And I think that shows that you don't have to be a big division with multiple resources to create something doable and helping our patients. Lung Nodule Clinic has long been my passion. You see the pictures of Scott Apperly and Chris Ryerson. Scott actually trained in Alberta, where lung nodules are subjected to provincial review, and we do not have that, or did not have that at the time. And many times when I order CAT scan for the heart and something comes back saying there's a lung nodule, some of them I suggest follow up in 3 months, some in 6, some in 12. No rhyme or reason. And I think all of us have been exposed to those tragic cases where somebody had a nodule and a year later or 2 years later, they come in hospital and have huge honking tumor in one of the lungs that's perhaps no longer operable, and the opportunity lost to prevent it. So Scott and Chris, and again, St. Paul's Foundation help and CST work around and collaboration from John Ellis from from diagnostic imaging have created that, and clinic started in January. It's going to be a simple algorithm-based therapy for nodules and based on the most recent scientific guidelines, who needs it, when, for how long. And I think if this works, which I hope it will, then the next step would be to spread it provincially. There is nothing here that's property protected or anything. Opioid stewardship program, again, a shout out to Dr. Nolan and her team. They came up with this idea based on very much on antibiotic stewardship program, and this has been an overwhelming success, to the point that VBHC picked up full funding as of 2021. Many of you know that, depending on where you read, 42% or more opioid addiction often starts with the prescription medications that are given in hospital. And this program has, I believe, created a evidence-based way of limiting that exposure. Here, DOM Innovation provided money for evaluation of these projects, which Shona and her team has done, and I believe it's already published. This was a source of numerous presentations, I think a couple of dozen presentations about it. So again, speaking to what Kristine has already told you, the many ways the DOM Innovation can support you. They did have a grant from Vancouver Foundation, but there was no money for evaluations. That's often is the case when it comes to granting. This is Spin Clinic. This is Kristine's baby, so to speak. This is, I mean, this was so visionary. I knew nothing about that, but people who have immune-related disorder neurology used to come to St. Paul's Hospital and other hospitals in the province to receive immunoglobulin, IV immunoglobulin. By doing that, they took beds in short stay unit. They were exposed to other sick people since they immunocompromised, and that kind of made no sense. And Kristine came up with this idea that this could be moved home at a fraction of the cost with the nurse educators. And Kristine and Katie came up with this Spin Clinic again. We helped creating a business plan for it. Why this was visionary? Because when the COVID came, that venue for people to receive their immunoglobulin would have been not available. Plus, they would be exposed to COVID, which at that time was our hospitals were full of. So this is perhaps the best example of how quality of our patients' care would be positively affected by what we consider broadly an innovation. And that's a great idea, Kristine. I think success of it led to a few other projects, with some of it I will show you in a moment. This is the compression neuropathy clinic. Again, we have now branched out of Department of Medicine and into other departments. So for example, Sean Bristol is a plastic surgeon, and anybody who had a patient with compression neuropathy realizes that to fix it, you need time, you need to be speedy, you need to get all of that evaluated sometimes the same day and have a surgery within 2 weeks. And it's not been happening until this project came about, and through creation of streamlined coordinated care to multidisciplinary care, this is now being operational. And Kristine just shared with me the news that hospital administration, looking at how important this is, provided our plastic teams with 10 extra sessions in the operating room, so this can be taken care of very quickly. Another example of how innovation improves care. This is perhaps second last example of what I was quite proud of creating with my colleagues in DOMI. It's a collaboration between allergy, immunology, Dr. Ruiz. This is Dr. Tambu from ENT department. Many of you know that aspirin sensitivity is often well, not often, it is always a big problem, and that you can improve it with either the sensitization protocol or removing polyps, which are often associated with that condition. And that clinic has been operational. They already looked after 120 patients treated medically or surgically, and then had 7 aspirin desensitization in the last calendar year. We supported that through pilot project. We hired a team to help them write the project chapter. We're now looking at the evaluation phase of it. And that's, again, the only such clinic in province. And lastly, I want to talk to you about this. This has been a long-standing dream of mine. St. Paul's is a big center for maternity, but it's estimated that about 25 or 30% of women who deliver here have often complex medical conditions. Where I'm at in cardiology, cardiac obstetrics clinics has been in existence first through Dr. Keys and now Dr. Grewal for decades. However, other conditions, dialysis, GI problems, hematology, respirology, are also present, and you only have 9 months. That's how long a woman is pregnant. So there is a little bit of urgency. So we're now creating these complex medical conditions in pregnancy together. It's a picture of Val Reichel from obstetrics. Monica and Jasmine are our departmental representatives, and I'd like to see this. This is a clinic without walls. It's essentially about coordination of care, rolling out perhaps later this year, and then maybe within the province. So we're very proud of that. Here is the list of DOM innovators. Those are people who have submitted their proposals. All of those proposals ongoing. I think last time Kristine was 16, 17. Some of them have been funded without our help. So it happened that somebody else picked funding, and I think some of that is going to come up with the latter part of your treatment. I think one of the new sensational funding is for women's health endocrinology clinic that's just received the big grant. I will stop here, and I'm sorry I have to go to work. Fundraising. I have a fundraising lunch with one of my colleagues, and I hope to bring some more money for this. So thank you for your attention, and over to you, Kristine.
Thanks, Andy, for that really whirlwind tour of the successful projects. And really congratulations to all of you who are working. And I know there's a lot of innovation happening within the department, not through DOM innovation, and we see that and appreciate that. I think that's impacting patient care. I'd like to shift gears and talk about another aspect of work that we're doing with DOM innovation. The Ideas Forward 7 years strategic plan laid out under the quality, safety, value pillar, an aspiration to practice value-based healthcare. And some of us sort of scratched our heads, and as we learned about it, thought, that's really interesting. I really like those concepts, but how is it going to happen? How are we going to actually operationalize that when we move into the new St. Paul's? We're not going to all fall into teams of coordinated care. So one of the things that we want to do in DOM innovation is to create a structure whereby we can build capacity for value-based healthcare. Very briefly, you've heard a lot about this from Shannon Jackson and the value team and other people, but to touch on this, I've learned a lot. I went down and did a master's degree in Austin, in Texas, at the Value Institute, in part around value-based healthcare. And the model is really well designed for patients with complex medical conditions. It's about care. It's adding value from the patient's perspective. And you add value by improving outcomes. So it's really about the patient's outcomes. And 3 of the big points is providing organized care in a team-based fashion, Number two, it's measuring outcomes. It's incredible to me in medicine to realize how much we look at biometrics, we look at process measures, but we don't look that much at outcomes that patients care about. Can they walk on the beach with their dog? Can they get dressed in the morning? We're better at measuring their glucose and maybe their time to TPA, but we're trying to shift the measurement. Not to say that we don't want to measure those other things, but they're a little bit in service of that outcomes that matter. And thirdly, many of us look at the individual pieces. In the EMG lab, I love to see them. I do their EMG and off they go. But I don't look at the full cycle of care, for example, with the complex nerve injuries, from injury to nerve recovery. And so it's really looking at adding value over the full cycle of care and looking at what the costs are, because that's where we see opportunity. All right, so we put together a proposal together with our colleagues in shared care who've been terrific. A shout out to UA1, who's down at the bottom, who's our project manager. Brad Little is a family doc at Spectrum. He just won a big award for family doctors, so congratulations to Bradley. He's the co-lead for this. And then, of course, Shannon Jackson has been a key partner all the way through. We put in a proposal. We were successful in obtaining a $1.1 million grant over 5 years where we can sandbox some of these ideas. So this proposal has two parts. The first is building capacity through interactive workshops around a gap in care. So we bring a workshop to your group around a gap in care and bring everybody from the MOAs to the family doctors to the surgeons, whoever is involved in that, like a diabetic foot, for example, all the people who are involved. And then we do a 3-part interactive workshop. The second part is IPU development. So they get to work with UA and our team to develop into, instead of people providing care for that patient condition in a discoordinate fashion, trying to be like birds flying in a V formation and really on the same page. This whole project, and this was Nadia Stryland, had the idea that it should be around gaps in care. What is a gap in care, and how do we coordinate ourselves between family practice specialist care to really smooth out those bumps? If we've been a patient ourselves or our family, we know how rocky that is, back and forth from the community to the hospital, and we want to smooth that out with our team. From the workshop groups, one will sort of emerge as being ready to go to develop into an integrated practice unit, and over a year or two, they'll be supported to develop, identify what are the measures that matter to patients, and how do we operationalize that. So the idea being, after 5 years, we'll have 5 different model or prototype IPUs that then we can all use the toolboxes, the tools that we've created to do that within our teams where appropriate. So if your team, if you think this is a good fit for your team, you can contact our Dom Innovation, you can contact me or our website. You can go and there's a box to select. So that is really exciting. We're in our year 1. We've had 2 workshops. We did a workshop with a complex medical team. We did a workshop with the nerve injury team, and we did a workshop with people working around diabetic foot complications. And they've been so really fun to do and kind of inspiring. All right. I think we've all been hearing about innovation. I think it's been a conversation point. And what I'd like to talk about briefly is how Dom Innovation fits into the larger innovation ecosystem. There's a lot of stuff being done. There's skunkworks, there's all these interesting things, but until recently, it hasn't been as coordinated as it could be. Recently, there's been the creation of what's been branded as Innovarium 360. I have to say, it's really growing on me that the name is. I think it's a good name, and really, the idea is to ensure coordination and cooperation between all of these branches. So to highlight, there's 3 big sort of buckets. One is through FIRE, which is really focusing on ideas that require validation, require development, and also knowledge translation would fall under that. Venture is more the, in working with industry partners, working on commercialization, co-developing technology solutions for complex medical things, and then ideas forward. And ideas forward is not just for physicians, but for all hospital staff. And it's the clearinghouse for ideas to come through. And we very much partnered with Ideas Forward. And I think that there's a value, I hope we can convince you, to having a departmental mechanism that's really close to the bone, because innovation happens at the bedside. You are the ones who identify the problems and create the solutions. So having a Department of Medicine platform that can help us prioritize and support sort of close to our members, at working in collaboration and in synergy, I think it's a nice model. The Innovarium 360 is just getting going, and this is sort of hot off the press. In fact, I think it's really 2 days hot off the press, this graphic, and it looks at how they're going to have the ambition of building the type of organization that's really known as a place of innovation. So having the mindset, having the coordination and support, having the resources, and then connecting all the different blue circles that are doing innovative work together. From a physician's perspective, the other important thing to know about with regard to innovation is the PAC, or the Physician Advisory Committee. One of the big pillars is, discover, learn, and innovate. And that was headed up by Amin Sajan, and now Jesse Greiner has just taken on as the interim head of that PAC. And one of the things Jesse's just started is the Signal Group. So if any of us who are interested in innovation, this is a really good way to stay connected, to hear about funding opportunities. And so Jesse has invited you to, you can scan that in a high-tech kind of way, or you can call Jesse and he'll sign you up. But I think that for us as a physician voice, the PAC is an important avenue around innovation. If you want these contacts, I'm happy to share them. These are the Ideas Forward Ventures and FIRE contacts, and just let me know. I can pass on those contacts to you. So we wanted to close with a bit of a reflection on a super important topic, and that's that's burnout. And I think even before the pandemic, there were a lot of stressors on physicians' time, on our emotional content, our capacity. But during COVID-19, it tripled the odds that a physician was going to report burnout. And so I think this is really important. I think it has a lot of impact, retention, recruitment, on our joy at work, all of those things. So I think this article that Dr. Palapu, Nadia Khan, and others authored in 2022 in the BMJ, really close to home, VGH in St. Paul's, that said that during at the peak of the pandemic, that 2/3 of internal medicine specialists were suffering from some form of burnout, and that 20% had either considered leaving their position or had stepped down from some aspect of their job. So that's incredible. Those are incredible numbers. At the same time, I was, asked to take on this work, and I got to, develop the spin clinic, and I like new ideas and trying to get things through, or helping our division members get things through. And reflecting on my experience, that's when I felt energized and I felt like excited about medicine. And that's why I went into healthcare, to make it better for patients. And then in this work, thinking about how the people we get to work with seem energized and inspired. And it made me wonder, and I'm interested in your thoughts, whether innovation may be an antidote to burnout, right? It's not just about doing less when we're burned out, but perhaps it's about doing the things we think are important in a way that's supported and validated. So I wanted to just share the couple of pieces of data. After we've been up and running for 3 years, we asked the Office of Strategy and Results to give us some feedback and evaluation. And it was incredible. They interviewed 22 hours of interview. It's just an incredible report. It was so helpful. And one of the questions she asked was based on a Mayo Clinic leadership and engagement paper. And she was trying to get at, before I had this conversation with her, she was thinking the same way. She was trying to get at engagement and work satisfaction. And what she found was 88% of PHC physicians who participated in DOM innovation were satisfied or extremely satisfied with participation with respect to workplace engagement, professional fulfillment, and meaning in work. And these weren't the people who we funded. These were all comers. These were the people we didn't fund and funded. So to me, in the height of the pandemic, that 88% were feeling that way was pretty significant. Now, it's not a direct correlation, but I think we can compare that to the 2021 Doctors of BC survey that showed that only 49% of physicians feel they have adequate opportunity to improve patient care quality and safety. So for me, it's food for thought, and really makes me wonder about how we build our systems that we can support innovation, small and large. Future directions. Innovation isn't just about opening a new clinic. There's a lot of different ways you can innovate, and we're thinking in DOM innovation about how we might support a broader definition of innovation. I think one of the key areas, and we've heard from you, planetary health. We know there's a code red for humanity that the United Nations has decreed, and it is part of our mission forward plan. Sustainability is one of our foundational principles. And how do we, through the Department of Medicine and DOM Innovation, support that? We had our first breakfast the other 2 weeks ago, I think, and so heard about so many ideas and people's commitment to planetary health. And I think we'll hear more about that going forward. PASS has just determined that that's a priority as well. And there's going to, I'm hoping, I know that will be a bigger direction. We're thinking about how do we make Cerner usable, take advantage of the data. Maybe we can support people that, and building our partnership with the foundation. We have some pretty exciting opportunities that I think are going to come to fruition that will enable us to support your work even more. Our next intake cycle is in the fall. If you're interested in the shared care, if your group is interested in the shared care, you can contact us. That will be, we'll be looking at the next cycle for that in the summer, so you can sign up. We do have a website with all of the resources, and you're very welcome to contact me. I'm happy to have a one-on-one conversation at any time. So in conclusion, we've heard a little bit about the nuts and bolts of how we do what we're doing. We're learning and evolving as we go. We're open to ideas. We've heard about some of the successful, incredible, transformative projects that you're doing. We've heard about the Shared Care Initiative, where we're partnering with family practice to bring in and build capacity for value-based healthcare, and where DOM innovation fits into the larger innovation ecosystem. I hope we've ended with a little bit of an inspirational note about the potential for innovation to counteract some of the burnout we're seeing in healthcare. And we look forward to supporting your innovative ideas as we go forward. Thank you. So I'd like to open it up. Do you want to come up to you? And do you want to open it up for questions? I don't know if anyone in the room has a question before we go to the comment. Any comments from the foundation perspective, Tracy?
We're very happy to work with you and be able to support such exciting, innovative programs and see the impact for patients. So I saw several things on there that I personally get involved with, and it's really exciting, and appreciate the leadership that you're showing.
Great, thanks. Were you guys able to hear that? Hopefully. Okay, she was echoing the sentiment of feeling excited about seeing the projects and enjoying the partnership. All right, and then? Did you have you're on the screen. I don't know if you had a
Oh, I'm on the giant.
You had a key role. I don't know if you have any comments from the PAC leader.
Yeah, that's a little intimidating. Yeah, I'm not a member, obviously, of the Department of Medicine, and I think the structure that you've set up is so fantastic, and hopefully will be complementary to the work that's being done with the Innovarium 360 and the work of the PAC. I just a couple of comments. The first is that your words around burnout, I think, are super salient. And I think some of the struggles that we had initially when the PAC was being set up is that some of this innovation work, which really should have been helpful towards preventing or mitigating the effects of burnout, were actually contributing to it because there weren't good support structures in place across the organization, either at the organization level or the department level. And it would lead to, this feeling of you're doing all this work off the side of your desk for something you believe in, and then there weren't the supports to get you over the hump, and then you would just drop it, and it would add to that frustration that you felt. And I think that the structure that you've set up here goes a long way towards mitigating that. So I guess that's my first comment. My second comment is trying to capture the success of your department at the kind of leadership level. And I wonder if my question would be, has your leadership had the opportunity to spread the word to other departments' leadership and hopefully scale this across the organization? Thank you.
Yeah, I think one of the goals when Ideas Forward and Deb Mitchell's group and Mark Greenfield and Holly, when they did such an in-depth evaluation, when we invited them to give us feedback, and they really did an outstanding, very, very detailed evaluation. I think part of that and our discussion was to understand what works really well, what could be tweaked, and then use that as a model to scale up organizationally. Of course, they're not replicas, their mandate is different, but I do think that Ideas Forward has been able to capitalize on some of the things that have worked, and we were really flattered that model was sort of scaled up, adopted. So that would be the first thing. There have been other, I met with Tracy Scott from surgery. She wanted to hear what was happening. We've had discussions sort of with Trina from anesthesia, different people who are interested sort of unofficially, but I don't know at the SLT level if there's a discussion that way.
I think they want to scale it through OS.
Through OSR, yeah. So yeah, hopefully that answers that. Any other questions in the Zoom? I can't see your hands on my screen. So if you just speak up if you have a comment. Okay. All right, then I will close and thank you all for coming and being part of this discussion. We'll see you.
Bye-bye.